And now for more on the outbreak of Lassa fever in Nigeria, let's bring in the founder, Love for Health Foundation, Dr. Yusuf Haroun. Dr. Haroun, thanks for joining us on the news tonight. What really would you say is driving the rise in Lassa fever cases, and why haven't we cracked this year after year?
Thank you very much, Nifemi, for this very important question at this time. It is an epidemic that is an outbreak in Nigeria, and the main vector or mode of transmission are through multi-mammate rats. So it is animal to human transmission. That's the primary mode of transmission. So that's the rat there on the screen. And it is because of the multiplication or the proliferation of these rats in our environment, especially in the regions which were mentioned, the Middle Belt. You have it in Edo, Benue, Taraba. You also have it in one of the states in the southwest, Ondo, and Edo, in one of the states in the south and the northern part. So we need to get rid of these rats, multi-mammate rats. They are the primary mode of transmission through their droplets, feces, and urine. Once it gets contaminated in our food and we eat this food, then individuals are susceptible to develop Lassa fever. Lassa fever is a viral hemorrhagic fever. It is similar to other fever that cause bleeding from the orifice, from the nose, from the mouth, from the rectum, from the urinary tract. So these are called viral hemorrhagic fever. Other examples are Ebola fever, Ebola virus, the one that we had some years ago, which Stella Adedevo helped us in curbing it. We also have yellow fever. These are examples of viral hemorrhagic fevers. Dengue fever. So they have pathognomonic features in which they develop high-grade fever, you have body weakness, you have lethargy, sore throat. The problem is that many people don't know they have this condition. Everybody thinks they have malaria once they just start having fever, headache. They don't know that it's another condition that can cause this similar presentation. People just think, oh, it is typhoid and malaria, and that is a problem we have. So it is because of ignorance and because of proliferation of this vector, these multi-mammate rats in our environment.
Dr. Haroun,
that is when we
know rats spread Lassa, but what's that one thing government and the public still are doing right in stopping this?
Two main things. Number one, public health education. Number two is hygiene. So the government needs to enlighten people more about this. And we also have to provide good hygiene. Look at our environments. Look at the gutter. Look at the sewage. What are the things that attract this type of rats? When there are large dump sites, sewage, refuse bins all over the roads, even in our houses, which we have to do, and in the environment which the government has to do, large environmental sanitation. I'm happy that Lagos, which is one of the most densely populated states in Nigeria, doesn't have this record of the outbreak as we have in the 5 states mentioned. Kano is another state which doesn't have that record. But imagine if the government is working more on hygiene and sanitation together with public health education. So these are the things that is going to help. I'm happy you also asked this question because Love for Health, we are trying to partner with the local government. So the local governments can also help in bringing about more health sensitization. And in Lagos State, local governments like Apapa Igomu, like Mushin, Bariga LCDA, and also Ifakojaye. So these ones are already trying to bring more health sensitizations and to bring public health awareness together with Badagry local government. So apart from Lagos State, all other states can promote healthcare, health education, health sensitization, community health outreach, and personal hygiene, environmental hygiene. All this can help, particularly eradication of these multi-mammate rats, because the proliferation of these rats can cause this Lassa fever. So we should try to maintain good hygiene. We should try to eliminate it. And as the professor said, there is no vaccine for it, but there is a particular medication which you can administer at the early stage, which can be effective, and that is called ribavirin. Ribavirin can help to manage it in the early stage, but unfortunately, many people don't present at the early stage. The incubation period is between 6 to 21 days. Many people will present after 14 or 30 days when it has already shown the late signs of the illness manifestation. They are already bleeding. They are already having high-grade fever. And unfortunately, some cases, they just record the deaths.
All right.
And I will say this again. It's unfortunate, but many of these cases are not recorded. So the casualty which you mentioned, 155, they are more than that. About the number of people affected by this Lassa fever, there are more people who are infected. Some people will die and they will think it is malaria fever, whereas they were infected by Lassa fever.
Dr. Yusuf Haroun, good place to leave it. Thank you for sharing with us on the news tonight.
Thank you very much, Nifemi.